turnkey program that you can plug your patients into to get them on the road to optimal health. And what we love is being able to reduce and eliminate medications based on their individual success. So I'm sure that's probably something that excited you about this, right?
Yeah, you kind of get tired going around the same loop with people, and they can't get the execution part of the equation down. And so Greg and I were talking about, how you bridge the gap for people, and with the hand on the wheel with Take Shape for Life, I think from what I can see, that's where that transition really gets traction for people. So yeah, I'm curious to see how you've integrated that, both in terms of the product and the skill set the patient gets. And then also one of the questions, we've looked at some different value added services with our practice, and I don't know about where you're at, but there's a lot of concern with, kind of the Stark and the kickback approach, and trying to really be cautious with that. And I'm curious how that looks for the practice end of it. So,
okay. Well, why don't we address that first, because that could be something that stops you dead in your tracks. So let's just overcome that. First of all, as far as Stark goes, Stark is just relating to anything that has to do with Medicaid and Medicare that's billable services. So since our program was set up to alleviate any thought of Stark violations, the transaction is between the patient and our company. So there's no insurance reimbursement or anything to do with Medicare and Medicaid guidelines. So that eliminates that 100% right off from the get-go. And I've had this conversation with a lot of the legal counsel for a lot of the large practices. And, so we kind of put that to bed right away. The other part, as far as kickback goes, something that can be construed as a violation of the kickback laws would be, let's say if you have a lab down the block that says, hey, doc, you send your people here for their tests, we'll give you $50 for every patient that comes here. Obviously, that would be a clear-cut violation. With this, you're being paid. It's the same as a fee-for-service reimbursement model, because you are administrating this program in your practice and you're getting paid for your expertise. So this isn't those two areas, Stark and anti-kickback, the way this was set up from the beginning was designed to not even have those things in the equation. But also for your own, not just hearing it from me, you can also speak with our counsel directly at Take Shape for Life. There's one of the attorneys there, Courtney Mason, who has these conversations with a lot of the physician groups. So she can put you totally to rest as well with that. One of the things that I found, you talked about bridging the gap. And that is a term that I use quite often because, for years, most of us have always referred to a registered dietitian, a nutritionist, or a weight loss program that people have been successful, maybe Weight Watchers, Jenny Craig, Nutrisystem, things like that. But a lot of the times when you make that referral, 99% of the time when the patient leaves your practice, the thought leaves their head until next year when they come back for their annual physical or something in between. So when we have the Take Shape for Life program in the practice, it makes it very easy for a patient to see that your team is taking a proactive approach and having this in the practice and endorsing it. And one of the ways that we have been able to do that, as a matter of fact, it's funny, I was just at a practice this morning and I have some of the things that I bring with me. We have like a simple flyer that we put on the back of treatment room doors. So patients are able to see that you have an upcoming seminar that you might do. That's one of the ways we've been very, very successful is by conducting a monthly in-office presentation. Mm-hmm. And that presentation is where we really capture people because there's strength in numbers. The practice that I was at this morning, the gentleman's an interventional cardiologist, and he has us do meetings once a month in his office when he's in the cath lab. So he actually schedules appointments, an hour consultation for patients to come to these meetings. So it's on the books. His staff is calling to confirm, and they have a computerized system that calls patients to confirm. So everybody shows up, and we're there explaining the program in about 20 minutes, answering questions for about 15 minutes, and then the people who are ready to come on board, we give them an opportunity right at that meeting to enroll in the program. So for a practice like that, where the doctor's not there all the time, during the day works, but for the majority of the practices that are in clinic all day, we usually do those right after hours once a month. And that's been extremely successful. And your support team, which two of them are right here, would be the people who would do that type of presentation. And it's a very professional PowerPoint that we utilize, and it just answers all the questions. And what I love before it, Doc, before they sit down for that, we have them fill out something we call a well-being tracker or a client profile. And the questions that are asked in that short form really get their mind ready to receive what they're going to hear in this presentation. So those are some of the ways that we do it. And then in addition to that large flyer, which is just 8.5 by 11 that goes on the back of a treatment room door, we printed up 4 up as well. And we cut those up. We ask the doctors and staff to hand one of those when they're interacting with a patient in the office. So this way you don't have to, you know, like you're obviously on board and want to help your patients, but I don't know if your other partners address the white elephant in the room all the time, you know? So what we do, instead of having a physician, even though, you know, with you know, all the rules and regulations now, if someone has a BMI of 31 or higher, you're meaningful use, you're supposed to talk to these people about this. A lot of people don't. So when we have these cut up and handed out, it's the size of a prescription pad, if people are still using those. And we hand it to someone and simply say, hey, this is a program we're endorsing in the practice, and we're looking to get our patients healthy, in addition, the entire community. So you might know somebody at home or at work that can benefit from this program. So why don't you take this home and share it? And 9 out of 10 times, the patient who needs to do the program says, hey, this sounds like something that's good for me. I think I'll be there, and I'm going to bring a friend who could benefit from it as well. So those are a couple of simple ways to generate a meeting style like that. There are some practices that do it differently. Some will capture names and hand them to a health coach, and then the health coach will reach out to those people. But I have found over the past 10 years that I've been implementing this in practices that doing an in-office meeting is a home run, because the people love it there, they trust you, and when you're offering it in your practice, they're going to come. Would you agree with that?
How often, yes, I would agree with that. How often are you having the docs in the presentations then, particularly the after hours meetings? Are you having them present for that?
Well, that's a great question. What I feel is a tremendous benefit and brings much more buy-in from the patients is if one of the docs, and if you have 5, you know, this could be one like 10-minute staying late every 5 months. And all they need to do is introduce the speaker. And then that just gives that speaker, you know, all the credibility in the world, because you're endorsing it and you know, talking them up. So that would be the ideal scenario. Although honestly, we have many practices that they leave a staff member behind. So someone's there to lock up, and they run it that way because you've already done the initial inviting, which is usually adequate. And that's how that works. But for the best results, I always recommend having one of the health professionals. Doesn't necessarily have to be the doctor, but some licensed health professional just introducing the speaker, if that makes sense.
Mm-hmm. Okay. So then what's the thread of follow-up look like with the patients back to the provider into the network? Obviously, they're having connectivity with the health coach and probably getting on the eating plan and exercise plan and all that. Do you guys have some structured format that's worked well to tie the loop with the physician into this?
Well, that's a great question. And what we're not going to do is obviously tell you how to practice medicine. But what we suggest, especially for people who are on blood pressure medication, cholesterol medications, diabetic medications, especially your diabetic patients, you're going to want to have them come back in within 10 days, possibly to do another hemoglobin A1C, because as they're eating on our program every 2.5 to 3 hours, it's going to stabilize their blood sugar, and those medications are going to need to be adjusted rather quickly. So what that also does is get the patient back in the office to see some positive results, because you will be reducing the oral diabetic medications. Most of our docs will reduce oral diabetic meds by up to 50% within the first 2 weeks. So number one, it's giving the patient hope, because it's not too often that people are reducing their diabetic meds. They're usually adding something else on to combat, the problem. So that is one thing that we recommend. And also the things that take a little bit longer are lowering of cholesterol. So, usually within 60 days, we're redoing, maybe a complete CBC to see what's going on with the patient overall, and being able to reduce and eliminate those medications based on the individual patient's success. But with that said, there's a number of ways to handle the coaching of the patient. And in a lot of the practices, we find someone within the practice that might have done the program and is jazzed about it. And it also gives you an opportunity to reward, maybe like you guys have been in practice for quite a while, you might have an employee that is very valued, but they might be at a ceiling for income. So a valued employee can become a health coach that's sponsored by you, the practice, and now they are interacting with those patients on a weekly basis on the weekly client support call that we do. So each week, we're reaching out to the patients to check in with them, to see how they're doing, to celebrate their success, or maybe to find out why they ate a sleeve of Thin Mints because it was Girl Scout week or something. So these are the different scenarios, and I don't know how Greg and Paula have presented this to you as far as that goes, but that's one option, having an in-house health coach, with the understanding, Doc, that they're not doing any of this health coaching for additional income within the practice hours. It's something that they would do outside of work, usually in the evening when those patients are home. And health coach in a practice can usually max out at about 30 to 40 patients. And they're making these 2 to 5 minute checkup calls once a week. And they could usually do that in 1 or 2 hours in the evening during the week. Another option, which again, I don't know exactly what you guys have discussed, but another option is assigning a health coach that Paula and Greg would help you with, to assign to your practice, that would be the outside person that would manage and coach your individual patients.
Yeah. So you mentioned that the way you've structured some of this is a fee-for-service model, as the provider is providing a service to, I guess, the patient, but also tell me how that works. I mean, is that a financial connection between Optavia and I don't even know if I'm saying the name right, but anyhow.
Optavia.
Optavia. Oh, that sounds better.
Yes.
So,
Well, the financial, the way the whole financial structure works is that our company is paying your practice to support this program. So you're not being paid by the patient. The transaction between the patient is between the patient and Take Shape for Life / Optavia. So that's what they're going to see on their credit card statement. Nothing from the practice. Because let's face it, patients don't even want to make co-payments when they come in, right?
so what's that payment matrix look like for a practice then? I mean, are you, let's say 10 patients come the way of Paula that want to do this out of my practice, what does that look like?
It can be a very lucrative model. The way the income flows, we pay back to the practice somewhere between 18 to 31% of the dollar volume placed in orders by your patients. So that fee is paid to you to administrate this program in your practice and ensure the patient's success through your coaching network. Mm-hmm. And so the magic number is $6,000 in volume, which represents about 20 clients on the program. A practice your size would most definitely max out our compensation, usually within the first meeting if you're doing a group style meeting. Usually, a practice with 4 or more practitioners is generating, over the course of a year, you'll probably have about 200 patients on the program based on the amount of doctors that you have. And 200 patients on the program can generate a couple of $100,000 of revenue for the practice. Mm-hmm. So the nice thing about that is it's very clean. You're being paid by our company to support this program in your practice. The nice thing about the model is that there's no the patients aren't paying you. It's a very clean transaction. The patient is strictly has their own private account that they manage with our company with their own username and password. So they're in total control of all of the products and everything that they receive. So they're actually ordering it, and we're supporting them as far as the health coaching goes to ensure their success on the program. And in addition to a health coach is more of like a concierge that guides the patient through the support. We also have a nutritional hotline where a patient can call one-on-one and speak with a registered dietitian, a personal trainer. We have behavioral specialists available as well. And those are one-on-one calls that are free for the patient as well. We also have weekly webinars where we do our habits of health training that all of our clients across the country are invited to. And that's just another educational piece. So we have so much available. And do the patients utilize everything? No, but they'll find the 1 or 2 things that they want to tap into weekly, and it just ensures their success and gives them a feeling of community. And one last thing that we do, we also have social media presence, but through secret Facebook pages, private pages, where we're able to have the clients interact with other clients that might be all over the country, as well as health coaches monitoring that. So we have a way for people to find whatever platform it is that they feel comfortable, to be hooked into a community of like-minded people. So the interaction in the practice is not the only interaction that they get.
Okay. What do you guys have out there as it relates to post-program follow-up, comorbidity statistics, any sort of improvement that you guys have been able to document with this being on the radar screen for, what, a decade now or something like that?
Well, I'll tell you what, our company has been on the radar screen for 36 years. And they have a number of different studies that have been done. But what I will tell you honestly is it's very, very hard to track statistics on weight loss, because what we're going by are ordering patterns. So you might have someone who orders once, doesn't order again because they reached their goal weight early on in the program. But I had the pleasure years back when I wanted to implement this in my practice, to talk with a group that was in New York before they were bought by a hospital system, which doesn't sound strange to you, I'm sure. They did a study for 5 years with their own patients. And the statistics, it was 2,500 patients that they did the study on. And understanding statistics, you really want to understand what they did there. They were able to track people, and they had a statistic that showed that people who reached their goal weight were at 60%. This is an unbelievable number. 60% of the people that reached their goal weight were able to keep the weight off for 5 years or better. So to me, that's a home run. But you know, as well as all of us on here this morning, that weight loss is something that incorporates so many factors, you know, emotional factors, emotional eating, crises that happen in people's families. So it goes way beyond the success of someone on an individual program. However, we have a transition program that once the patient reaches their goal weight, I believe this is the key to their success. We help them transition off the program. That transition period is about a 5-week transition where we're gradually ramping up their calories, taking out our medically formulated fuelings, and gradually adding in their own food. So we're gradually ramping up their calories, and this way it's ensuring that they're not gaining weight back because we're doing it gradually. And we've taught them over the duration of their journey the habits of health to be able to keep that weight off. And they most definitely understand what portion control is all about as a result of this program, and they get tremendous success. Another thing to think about is the 3 of us on here were former clients on the program. And what has ensured our success has been paying it forward and helping other people. I actually, when I was in private practice, now I'm full-time with Take Shape for Life for the past 7 years. I had a very, very busy practice. And as you know, you get wrapped up in a practice, you're there from 7 in the morning to 8 o'clock at night. My health kind of went on the back burner, and I wound up finding myself 60 pounds overweight. That's how I got involved with Take Shape for Life. So I got involved as a client. Patients started seeing what I was doing, and I started offering it to patients. And the key to my success over the past 10 years without gaining back an ounce is just being in the mix and talking with people, friends, and family about this on a daily basis. So you might find that out of your patient base, there are going to be some patients that say, hey, I would love to help other people pay this forward. Is that an opportunity for me? And we'll, if with your permission, we would share that opportunity with them. So that has been my secret to success in keeping 60 pounds off and turning from a doctor who needed my own advice to someone who trains for triathlon now. So that to me is what we hope for everybody, and I hope that answers those questions.
What kind of doc are you, Ken?
I'm a chiropractor, and I have had tremendous results with this. Dr. Anderson, I believe your doctorate is in osteopathy?
Yeah, I'm a family doc.
Dr. Anderson is a DO as well, and I just love his whole philosophy because similar to chiropractic, the premise behind osteopathy, as you well know, is a whole body approach to getting people healthy. And that's what this program has been able to do for all of us and the patients and the successful practices that we've been able to help with. But nothing is carved in stone as far as how each practice does everything. But just from our experience, we'll share with you the different anecdotes that have worked in different practices, the different scenarios. That cardiologist that I mentioned, when I told him about the way that we've been doing it successfully, he said to me, I want to do it differently. And I said, hey, what's your thoughts? And having the meetings during the workday, naturally in a cardiology practice, the majority of the patients are a lot older. So they don't necessarily want to be out in the evening and driving home when it's dark. So he suggested the morning meetings on the days that he's in the cath lab. So we're very, very flexible. We're going to want to do what's best for you. And, for my experience with implementing this in every specialty from oncology to obstetrics and gynecology, I would love to be able to be a resource for you. So if you have additional questions on the implementation or, anything that I can answer, questions that your partners come up with, I'd love to make myself available to you. Okay.
Yeah. I think getting a little more information with Paula and Greg on kind of the matrix of the dollars and cents. I think the concepts are great. I mean, it works. I mean, I'm all about that model. And yeah, so let me kick that around with my partners a little bit and see what this could look like here in Corvallis. I know there's a number of health coaches in our community because I've got patients that are on the program already. But I think the bottom line is the endorsement from a doc really lights people's fire a little more. So
absolutely.
Yeah. So thanks for your time, Ken.
Oh, it's my pleasure. And the fun thing about this is that we're spreading good health. Someone in Paula's organization has a great slogan. They say kick fear in the face. And a lot of people are afraid what's down the road because they see the increase in medications, the lack of activity, the lack of themselves enjoying their lives. And what we're trying to do is simply give people, as they get older, better health. And who can that come from better than someone of influence, like a physician like yourself? So I'm happy to, if you want to get your partners together, if they have questions, you want to do a joint conference, we could do it in the evening when everybody's home. I'm more than happy to come on board. Just keep me up to date, and I'll be there for you.
Okay, that might be something we do, Ken. That'd probably be helpful. So, yeah.
All right, perfect.
All right. Well, hey, take care.
Time, and I'll jump off, let you guys finish up. And again, congratulations on an amazing practice. These guys have filled me in on how successful you are, and we look forward to hopefully being a part of that.
All right, Ken. Thank you. Take care.
Right. Bye-bye.
Appreciate it. So,
well, hello there.
Hey guys, I did record it, and I'm still recording. I guess I can turn off now. Let's see, we'll stop here.